Hi, my name is Carolyn. I'll be your provider today. I'm going to go through your health history. So, first of all, I'm going to go with can you tell me what brings you in here today?
Sure. So I'm just in need of an annual physical assessment, but I have been having some pain in my lower back.
Sure. Okay. And then can you tell me the exact location of where the pain is?
Just like along here, like I would say, like the lower third.
Lower back. Okay. Um, and then does this pain radiate to anywhere else on your body?
No.
Okay. And then can you tell me when this pain has started?
I'd say the last couple of months, and it's not every day. So yeah, I just either put heat on it or I take some Advil.
And then is this like a new pain or have you had this pain previously?
It's pretty new.
Okay. Is the pain intermittent and kind of comes and goes, or is it constant?
It's intermittent. It's definitely not every day. It's just a couple times a week.
So when you do have the pain, like how long would you say it lasts, and like roughly how often does it occur?
So it usually comes more in the evening, and it's if I've been like really active during the day, and it's 2 or 3 times a week. Sorry.
Okay. And then can you describe what the pain feels like the quality of the pain?
It's not severe or sharp. It's just more kind of dull and achiness.
Okay. And then on a scale of 0 to 10, how severe would you say the pain is?
Like 2 or 3.
Okay.
It doesn't prevent me from doing anything.
Sure. Have you noticed that there's anything specifically that triggers the back pain?
Mostly just like if I've been moving a lot, but then sometimes if I've been sitting a lot too.
Okay. Is there anything you noticed that you were doing or anything that causes it to occur?
If I lift things, then it's more likely. I don't know, maybe I'm lifting incorrectly.
Okay. And then, if anything, what have you found helps the pain feel better?
So sometimes I use like a heating pad, or I take like 1 to 2 ibuprofen.
Okay. And is there anything that makes the pain feel worse?
Not really.
Okay.
Not really.
And then any other symptoms associated with this back pain that you have?
No.
Okay. And then for the medication that you said that you were taking, can you tell me like what the dosage and frequency of the medicine you're using for your pain is?
So it's just the over-the-counter ibuprofen, and I take 1 or 2 tablets. I'm not sure how many milligrams of ibuprofen that is, but it's just the over-the-counter kind. And nothing with the sleep stuff. I don't do that.
Okay. Like how long would you say you've been taking it for?
Oh, 2 or 3 times a week for, I don't know, 3 or 4 months.
Okay. And do you feel like the pain medicine is working well for you?
Yes.
Okay. Have you had any issues or side effects from taking this medicine?
No.
Okay. And then what other, are you taking any other prescription medications?
No.
Okay. Are you taking any other over-the-counter medications?
No.
Are you taking, using any like topical creams or ointments?
No.
Any birth control pills?
No.
Okay. Any like eye drops or ear medications?
No.
Any inhalers?
Mm-mm.
Have you recently or are you currently taking any antibiotics?
No.
And then are you taking any herbal or natural products?
No.
Are you taking any vitamins?
No.
Okay. Then, let's see here. Throughout your childhood, did you have any illnesses such as things like chicken pox, measles?
I did have chicken pox, but that was it.
Okay. And do you remember roughly what age you were when you had chicken pox?
I was kind of old, like 15, I think.
Okay.
I was in high school.
Sure. And then, do you remember how you treated your chicken pox? If you took any like medications or anything like that you remember?
My mom just put like the Caladryl on the chicken pox, and I did take a little Benadryl.
Okay. And then throughout your adulthood, have you had any either recent or more longer term illnesses as an adult?
No.
Okay. Have you had any surgical operations in the past?
No.
Okay. Have you had any hospitalizations?
Only when I had my babies.
Okay. And can you tell me a little bit more about, I guess, do you have any complications? How many children have you had? Like, kind of what the delivery process was like?
Sure. I have 2 pregnancies, 2 children, no miscarriages, and the deliveries were uneventful.
Okay. Any past injuries?
No.
You've had? Okay. And then we ask all the patients as well if you've had any traumatic events in your lifetime.
No.
Okay. And then can you tell me about any like recent screen tests or exams you've had? Have you had any like eye exam, dental exam, mammograms, things like that recently? Kind of what your schedule is for those?
I'm thinking I'm probably due for a mammogram sooner rather than later, and I actually have a dentist appointment for next month.
Okay. And then when was the last time, if you've been to the eye doctor at all?
It's probably about a year ago.
Okay. And then do you have any allergies to food?
No.
Any allergies to medications?
No.
Do you have any like seasonal allergies?
No.
Or environmental allergies?
No.
No. Do you have any
really
like
lucky.
skin allergies or allergies to any specific products or medications?
Not so far.
Okay. Let's see here. And then can you tell me about your immunization status? Have you received the sort of standard schedule of immunizations, and or have you had any flu or COVID vaccines recently?
So I recently had a flu shot.
Mm-hmm.
I did have COVID about 6 weeks ago, so I guess that's another thing I'll want to find out is how long I have immunity and if and when I should get the next COVID booster.
Sure. And so then have you had some more of like the, I guess, general schedule of vaccines, things like MMR, chickenpox vaccine? Are you up to date on those types of vaccines as well?
Yes, and I have had both shingles vaccines.
Okay. Thank you. So then can you kind of tell me about any medical conditions within your immediate family that you're aware of?
Well, I am adopted, so I don't have a lot of medical history.
Sure.
But so far I've been really healthy, and I do have a limited amount of information on my medical chart from my biological parents, but it didn't really say that there was anything significant.
Okay. And have you noticed any medical concerns with either of your children or your spouse that might affect them? Okay.
No, everybody's been really healthy. We've been really blessed that way.
Okay. Sounds good. So next I'm going to ask you about some more social history related questions. Can you tell me what you currently do for your occupation?
I'm a teacher. I teach math.
Okay. Do you use any tobacco products at all?
No.
Do you consume any alcohol?
Once or twice a week.
Okay. What would you say like an average day of drinking would consist of? Like different types of alcohol, quantities?
Usually like wine a couple times a week.
Okay.
A couple glasses.
Sure. Okay. Have you ever experimented with or taken any illicit drugs?
No.
Okay. Can you tell me about any caffeine you consume?
I have like a cup of coffee probably every morning.
Okay.
Every morning. Just 1 or 2 cups though.
Okay. And then can you kind of tell me generally what your diet consists of? Maybe just like a brief overview of what a day of your typical diet looks like?
Sure. So in the morning I usually have some yogurt and some fruit.
Okay.
And then for lunch, I don't know, I eat a lot of leftovers, so usually some kind of protein and some kind of vegetable for sure.
Okay.
And then for the evening meal, there's usually a protein, some kind of carbohydrate, and 1 or 2 fruits and vegetables.
Okay, sounds good. Do you have any concerns of exposure to any diseases or any like environmental exposures, things in like the air or in your home that you're concerned about?
No.
Okay. Can you tell me about your current living situation, who you live with, and where you're currently living?
Sure. I live in in a house with my husband, and we have a dog.
Okay. Let's see. Can you tell me about any recreational or types of activities you like to do for fun?
I like to play pickleball. I like to ride bikes.
Okay.
I enjoy reading. I am in a book club, so I get together with friends. That's pretty much it.
Okay, sounds good. And then we also ask people, do you have any concerns for your safety out in the community or within your home?
No.
Okay. So then next I'm going to kind of go through a review of the different systems within your body. So I'm just going to kind of list off some general symptoms. You can just kind of let me know yes or no if you are experiencing or have previously experienced any of these conditions or issues. I guess to start, can you tell me about what your sleep habits are like?
Yeah, well, I usually go to bed about 9:30 and then I set my alarm for 5.
Okay. And have you recently noticed any changes in your appetite or weight?
Not really.
Okay. Have you recently noticed any fatigue?
I can't really think of any.
How about fever or chills?
No.
Night sweats?
No.
And then next I'm going to ask about your skin. Have you noticed any rashes?
No.
Hives?
No.
Lumps?
No.
Sores?
Mm-mm.
Any itching or dryness?
No.
Any recent changes in your skin, hair, or nails?
No.
Okay. And then have you had any recent vision issues or changes in your vision?
No.
Any blurriness, double vision,
No.
blind spots?
Mm-mm.
You said your last eye exam was about a year ago?
Yes.
Correct? Okay. And then any pain or sensitivity to light?
No.
Okay. Next, I'm going to ask about your ears. Any changes in your hearing?
No.
Any current or past use of hearing aids?
No.
Any ringing in your ears?
No.
Any dizziness or vertigo?
No.
Any ear pain or drainage?
No.
And the next I'm going to go ahead and ask about your nose. Have you noticed any like stuffiness or runny nose?
No.
Any postnasal drip?
Not out of the ordinary.
Any itching or dryness?
No, not really.
Any bleeding of your nose? reduction or change in your sense of smell?
No.
Next, I'm going to ask about your mouth and your throat. Any issues or concerns with your teeth or your gums?
No.
How often would you say you visit the dentist?
Twice a year.
Twice a year. Okay. Any sores on your tongue, mouth, or lips?
No.
Any fever, blisters, or cold sores?
No.
Any canker sores?
No.
Any other sore throats or tonsillitis that you're aware of?
No.
Any changes in your voice?
No.
Any concerns with, so next I'm going to go over like your chest and your respiratory system. Any concerns with coughing or any like sputum coming up?
No.
Any concerns for difficulty breathing or chest pain?
Mm-mm.
Any concerns with coughing up blood?
No.
Wheezing?
No.
Difficulty breathing with exertion?
No.
And then you said you were due for a mammogram recently, or coming up here soon. Do you remember when the last mammogram you had was?
It was about a year ago. So I'm guessing it's supposed to be yearly now.
Okay. And then any other concerns, lumps, pain, discomfort with either of your breasts?
No.
Okay. And then have you noticed any, well, I'm going to go through like some cardiac concerns with you. Have you noticed any changes in like the color of like your fingers or toes, or like any blue color to your skin or your extremities anywhere?
No.
Any feeling of like your heart beating faster or slower than normal?
No.
Any chest pain or discomfort?
No.
Any swelling in your arms or legs or anywhere in your body?
No.
Have you ever had cardiac testing or an electrocardiogram?
No.
Okay. Next I'm going to ask you some questions about your gastrointestinal system. Do you have any abdominal pain?
No.
Any nausea or vomiting?
No.
Any diarrhea?
No.
Constipation?
Nope.
Or any changes in bowel movements recently?
No.
Any heartburn?
No.
Let's see. Any indigestion or gas?
No.
Noticing blood in your stools ever?
No.
Okay. I'm going to ask about your genitourinary symptoms. Have you noticed any changes in frequency or volume of your urine?
No.
Have you noticed any like frequent, either during the day or during nighttime, having to go to the bathroom more frequently?
No.
Any pain or burning with urination?
Nope.
Let's see. So you mentioned you have some pain or tenderness in your back. Do you have any other musculoskeletal pain?
No.
Anywhere in your body? Okay. Have you noticed any joint pain or swelling?
No.
Okay. And then next I'm going to kind of ask some questions about your blood and that system. Have you noticed any easily bruising or bleeding?
No.
Any bleeding gums?
No.
Any blood clots?
No.
Have you ever had a blood transfusion?
No.
Okay. And then any color changes in your fingers or toes from cold temperature?
No.
Any leg cramps?
No.
Any swelling in your legs or arms?
No.
Have you noticed any leg ulcers?
No.
Varicose veins?
No.
And the next couple questions about your neurological system and your head. Any dizziness?
No.
Headache?
No.
Any like blackouts or fainting?
No. Excuse
Any
me.
seizures?
No.
Any weakness?
No.
Any paralysis or feeling like you can't move certain parts of your body?
No.
Any numbness or tingling?
No.
Any burning sensations?
No.
Any memory concerns?
Mm-mm.
Any difficulty concentrating?
No.
Okay. The next I'm going to ask about your endocrine system. Have you noticed any changes in your thyroid recently?
I don't think so.
Any changes in your heat or cold tolerance?
No.
Excessive sweating?
No.
Excessive hunger or thirst?
No.
Any changes in the distribution or texture of your hair?
No.
Okay. And then have you, are you currently experiencing or have you ever experienced any nervousness or anxiety?
No.
Any mood or personality changes?
Mm-mm.
Any difficulties with insomnia or trouble sleeping?
No.
And then lastly, any hallucinations or delusions?
No.
Okay. So I think that's about all the questions I have for you right now. Do you have any other questions for me?
I don't think so.
Okay, thank you.
Thank you.
All right, well,